Welcome back. It's American Heart Month, and did you know cardiovascular disease is the leading cause of death in the United States? Leading a healthy lifestyle isn't difficult if you remember some basics.
That's right. Here to show us how we can stay heart healthy is Healthcare Partners Medical Group cardiologist, Dr. Stephen Portz. Dr. Stephen, it's great having you here. Thank you for joining us.
Thank you.
Welcome
Thank you for having me back. Thank you.
Heart disease is a big killer here in the United States. How prevalent is it?
Well, it's the #1 killer in the country, most prevalent disease we have, not just heart, but vascular and stroke disease. It's all part of the same disease. So it's a very common disease and one we're very interested in helping to prevent.
What exactly is heart disease?
Well, heart disease, there's many forms of heart disease, and the kind of disease that we're most familiar with is that of the blockages that causes heart attacks. That's one you hear the most of. There's many others, of course, and that's an area where we have a lot of room to help prevent this disease.
And what are usually some signs that I need to go see a doctor? Because we usually put it off and we put it off and we put it off.
Yeah, it can be rather subtle at times, and many times associated with fatigue, shortness of breath. The pain from heart disease many times is not nearly as bad as what you might think. It could be rather subtle pressure, tightness, not that horrible pain that you would think that it is. So anytime you have any of those symptoms, it's a good time to go get checked out.
Do women have different symptoms than men?
Many times women don't have as classic of symptoms as what men have, and I think most of the textbooks were written of classic symptoms because of men and their symptoms. But women, many times the disease may present a little more atypical, and you have to really listen and look at other things that are common, both men and women, to pick that up.
So what are the major risk factors for heart disease?
Well, there's 5 major risk factors, and that includes obviously family history, and many times family history is environmental as well. You know, the way we eat, the way whether our parents smoke and we smoke. But smoking is a big one, high blood pressure, high cholesterol, diabetes, and of course weight. Also now obesity leads to that as well. And
how does the foods that we eat make it worse for us? So can you talk about that, or the health changes? Food is important. Food and exercise are important. The foods that we need to eat are the healthy vegetables, the healthy lower fat meats, lots of fruits. Unfortunately, we live in a world where it's very fast paced, and it's easy to pick up fast foods or prepared foods, and many times those are very high in salt, very high in fat, not the healthiest foods for you. If you're a carnivore and like to have meat every day, you recommend sticking to the leaner cuts of meat? Leaner cuts. Obviously we know about chicken and fish and turkey breast, but then beef, also leaner cuts. Many of the meats that end in loin are leaner than some of the others. Okay. And then when it comes for people who are on a vegetarian diet, how do they get protein in their diet? Well, there's a lot of protein in vegetables. Actually, if you take 100 calories of a vegetable and 100 calories of a meat, you're going to get more protein out of the vegetables. No kidding. Just because so many of the calories in the meat are fat, and you don't have as much protein. Meat is a big source of protein for us, but a lot of vegetables, of course there are foods like soy products that are very high in healthy protein and also good for the heart. Is there one like magical food that not only it doesn't contribute to heart disease, but it might help reverse some of the damage you've done in the past? Well, probably not a single food, but a diet high in vegetables, low in high-fat protein sources such as beef and pork and whatnot. Gotcha. And again, just very quickly, signs of a heart attack. What do we need to look out for? Anytime you have worsening symptoms, fatigue, shortness of breath, onset of pain, tightness, heaviness, squeezing, many times up in the jaw, out in the arms or to the back. People become sweaty. You may not have all of those, but if you're in doubt, it's better to get it checked out. The sooner I can get you or we get you, the better chance you have a smaller amount of damage and a better chance of survival. Exercise is a very important thing as well. Some of us might not frequent the gym. If we don't, what can we do at home to help keep us heart healthy? Yeah, it's easy at home. Gyms have a lot to offer, but just walking, jogging, stretching is very good. It's a hard workout to do a lot of stretching. You can get a good sweat just from stretching. It's good for our joints and muscles and tendons as well. And then you just recently partnered up here with Healthcare Partners. Yeah, with Healthcare Partners. Tell us how that's going for you. It's going great. It was a big decision to leave solo practice and to go into a large group such as this, but the future of medicine has to change somewhat. We have to go more towards total care of patients, disease prevention.
having more time to do that, not just taking care of these fires after they've already started.
Absolutely.
And that's where I'll get to spend a lot of time with this. I think that's the future, the direction that we need to go in medicine to prevent disease. It will actually cut costs, but make us have a healthier population and be able to treat these people before things happen.
Patient-centered care. I like it. It's a pleasure. Thank you so much.
Thank you very much. Good to be here.
All right. Again, if you have any heart health questions, you can find Dr. Portz at his office on West Sunset Boulevard. For more information on Healthcare Partners Medical Group, call the number or check out the website on your screen. Still ahead of